Anyone who was in the Bay Area almost 3 years ago remembers the day the sky turned orange. That was September 9th. It was due to poor air quality caused by smoke from the wildfires burning across the state. It was so weird, as you may remember, surreal. Now, hundreds of wildfires burning in Canada are creating a similar effect. The smoke and haze is also affecting millions of Americans in the Midwest and the Northeast, sparking air quality alerts there. Reporter Laura Aguirre has the story.
From the city that never sleeps to the city that can barely breathe. New York briefly topping the list of world's worst air quality Tuesday by IQAir.com. Iconic views in a haze as smoke from Canadian wildfires drifts into the U.S. Across the Northeast and Midwest, millions of people are under varying air quality alerts. Several cities designated as having unhealthy air for sensitive groups, meaning small children and the elderly should reduce outdoor activity. In parts of Pennsylvania and New Jersey, another threat Tuesday, lightning. Rare, dry thunderstorms are forecast in the Mid-Atlantic region, where NOAA's Storm Prediction Center says conditions are primed for possible wildfire spread.
Hey YouTube world, harvest is plenty. I hope all is well. I was thinking about my subscribers and all my family and friends and loved ones who are on the East Coast. Due to the burning and out of control wildfires in Canada, the East Coast is being blanketed with smoke, which produces poor air quality. I want to discuss the air quality health index and the effects it could possibly have on your health. But before I do, let's check this out.
That's right, Rob. That's how big this problem is. Part of a platoon there of some 900 firefighters from around the world really headed into remote northern Quebec and other places to help knock down these fires that are affecting vast swaths of North America. Dark yellow-gray covering the sky across the Northeast as smoke from over 400 Canadian wildfires lapped southwards, enveloping cities from New York to Philadelphia, creating hazardous conditions and stopping most outdoor activity. Air quality alerts have been issued in at least 16 states. The mayor of New York City, Eric Adams, saying the air quality index there hit 484, where 50 is normal and anything over 300 makes for hazardous conditions.
They expect it to deteriorate further tomorrow afternoon and evening as smoke moves back over the city.
Outdoor city-sponsored activities in New York were canceled, along with Broadway shows and Major League Baseball games at Yankee Stadium and in Philadelphia. Low visibility slowing flights into Newark and LaGuardia airports. The White House saying 600 firefighters are headed to Canada to help put out the remote infernos, part of Canada's worst fire season ever, with an area the size of Vermont burning. It takes 12 to 18 hours for that Canadian smoke to get to the eastern seaboard.
We're seeing vulnerable people at risk, outdoor events canceled, kids having to be kept inside at recess.
Thick smoke is forecast for Philadelphia, Baltimore, and Washington, D.C. on Wednesday night and into Thursday. And it's creeping towards northwest Indiana and Chicago, which is trouble for those with respiratory issues around here.
But we're definitely having some additive effect to our regular Chicago pollution and allergy seasons.
So these wildfires are just raging out of control. It seems like there's no stopping it anytime soon. There are over 400 now. And so the air quality health index, it measures the risks associated with the bad air pollution. And also there's actions that you should take to protect your health. So let me just read this off to you guys. It says how the air quality health index is calculated, and it's based on 3 air pollutants, or a concentration of 3 air pollutants that are harmful to your health. That's ozone, that's nitrogen dioxide, and that's fine particle matter. It says these pollutants are considered the best indicators of health risk associated with the mix of outdoor air pollutants. And it has a rating scale. And I'm not sure if you guys can see this rating scale. Let me try to blow it up a little bit for you guys. It says the rating scale for the air quality health index from 1 to 10 plus. It says 1 to 3 is low health risk. 4 to 6 is moderate health risk. 7 to 10 is high health risk. And above 10 is very high health risk. Now, what's going on in Canada and the smoke there, and it's blowing all over into the United States, it's becoming a very high health risk. It says in Canada the air quality health index is over 10 plus. So it's real bad in those areas where the wildfires are raging. And the symptoms of wildfire smokes is headaches, mild cough, production of phlegm, sore and watery eyes, nose, throat, and sinus irritation. So people who may get affected from the wildfire smoke, they may think it's just allergies, but it's probably pollutants that's causing all of those things. And more serious symptoms, it says here, and I'm not a doctor, I'm just reading off the screen. It says dizziness, chest pain, severe cough, shortness of breath, wheezing, which including asthma attacks, and irregular heartbeats or heart palpitations. And so, just want you guys to stay indoors if you can. Protect yourself. Make sure that your windows are shut, your doors are closed. Check your air filters in your home to make sure that they're working properly. You might need to go out and get some new ones. Stay hydrated, take your vitamins, pray without ceasing, and all of those things. So I just want you guys to stay safe out there. Love you guys. Praying for everybody. Until my next video, thank you guys. Take care and God bless.
And this large trough on the East Coast picking up that smoke from Nova Scotia, as well as a fire in New Jersey. It's pushing it along the East Coast and all the way down here, even into the Carolinas. This smoke is really close to the surface, so it has prompted issuances of air quality alerts from New Jersey to Pennsylvania already.
Who needs to pay attention to this?
Anyone who has asthma, emphysema, other chronic lung disease, people who have pre-existing heart disease, people who are pregnant. There's also concern particularly about the elderly or young children.